If there's one prescription I wish I could write for every single patient, one with minimal side effects and maximal benefits, it would be exercise. Hi, I'm Simpiwe. I'm a medical doctor and a certified functional medicine practitioner, as well as the founder of Life Force Elite. Today, we'll be doing the last of our modifiable lifestyle factors by discussing movement and unpacking the importance of exercise and how you can achieve longevity, vitality, and clarity. Exercise, or the lack thereof, can affect how you feel, how you think, and of course, how you look. So, to keep it simple, we'll be discussing the why, the what, and the when of exercise and movement. So, without further ado, let's get into it. As I'm sure you've heard over and over again, that exercise is good for you. But why is it so important to keep moving? Well, first off, it obviously helps us to keep looking good. But more than that, exercise has been proven to improve your cognitive function, your emotional function, as well as prevent the onset of chronic disease and aging. And it does this by, for example, improving insulin metabolism, which can prevent or improve conditions such as diabetes, polycystic ovarian syndrome, dementia, just to mention a few. Exercise can also reduce inflammation as well as regulate your gastrointestinal function by aiding digestion. In addition, exercise has been well studied to improve mental health and delay the onset of major mental health disorders. Personally, I find that exercise is usually my main anchor during challenging times. Also, consistent and moderate exercise has been repeatedly shown to increase the release of BDNF, which is brain-derived neurotrophic factor. This is basically fertilizer for your brain, as it helps with the growth of new neurons. It also supports the existing connections of neurons and can also improve your learning, your focus, and your memory. Not only that, but it can help with your emotional resilience. Low levels of BDNF have been consistently linked to anxiety, depression, brain fog, and cognitive decline. And this is the one reason why exercise has become one of the main pillars of support when treating mental health issues, not as replacement for treatment, but as support for brain healing. So that's just some of the whys of the importance of exercise. Now, should someone decide to exercise, what exactly should you do? Like I always say to my clients, depends on your goals. Do you want a six-pack or do you want to optimize your overall health? In the latter case, exercise can be a combination of low intensity, weight or strength training, as well as endurance training. Examples of low intensity exercise include walking, mobility exercises, as well as gentle cycling, just to name a few. And this is optimal basically between 2 to 3 times a week. Strength training or resistance training is also quite important, especially to retain muscle mass and increase bone density. This can be done with weights or your own body weight, and it's recommended to do at least 3 times a week. And lastly, we have endurance training. You can do endurance training occasionally, and these exercises include HIIT or high intensity exercise or sprinting if you can. The point is to be intentional. The key is to choose exercise that's consistent and sustainable for you. Now, when is the best time to exercise? And again, you can choose a time that's more sustainable for you and your own routine. But physiologically, exercising at different times of the day does evoke different responses from the body. For example, early morning exercise can improve your circadian rhythm. It also helps with insulin sensitivity, as well as increasing daytime energy. Midday exercise will often align with your peak strength and coordination. An early and gentle evening exercise can reduce stress as well as improve your mood. However, in the evening, it's not recommended to do intense exercise, as this can dysregulate your cortisol release and therefore affect your circadian rhythm. In this case, more is not better. So that's just the basics of exercise and movement. There is so much more to unpack on this topic, but as we come to a close, I want you to remember When you engage in exercise, you actually want to regulate and not stress your nervous system. So choose to engage in movement that makes you feel safe and energized throughout the day. The key is to start where you are and choose consistency over intensity for lifelong longevity and vitality. As always, if you'd like to find out more about functional medicine or myself, head on over to lifeforceelite.co.za or check out our Instagram page at lifeforceelite. Bye for now.